All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today was supposed to be the open forum. However, I had been receiving a lot of messages and comments about talking about the deaths that are occurring in Germany, Norway, and of course, we talked about a death yesterday here in the US as well. We talked about it yesterday. The death occurred in December, or I believe early January. So I wanted to then make sure that we can address this news, if you will, and then we'll move our open forum to tomorrow. So I hope you're okay with this. I did not want to move it, but this became a pressing topic to talk about. So let's do this discussion. Welcome to everyone. And I'm going to start with just a quick thing today. So if you see here, if I can bring in, this is our Drbeen.com. Here is one news, and this is in the, I believe, British Medical Journal, and they say that Norway investigates 23 deaths in frail elderly patients after vaccination. Similarly, here is another news, and that is about the about 10 deaths in Germany within 4 days of administering the vaccine. And I think both of those are about Pfizer-BioNTech vaccines. So this is the basic topic. So the gist of it, right, in the beginning, I'll provide you the conclusion of this discussion, and that is that this happened in terminally ill patients or seriously ill patients who were either not able to handle the side effects that occurred, for example, fever or diarrhea, and the underlying disease process when superimposed by these after effects caused them to die. In other cases, it was just a coincidence that the patient's own previously underlying disease brought them to a point of death, although in the meantime they had received the vaccination as well. So these are the two basic categories you would see. And as we are giving the vaccines at a mass scale, you would see this kind of a coincidence of deaths occurring while the vaccinations are occurring as well. That is just a temporal relationship or time-based relationship, that somebody who is dying today because of their own underlying disease, and then they also got the vaccine today, does not necessarily mean that it was the vaccine that caused it. Of course, this also means that there are some cases where the vaccine is tipping them over, or maybe vaccine is causing the issue. So all these are the possibilities. I wanted to look at these deaths to understand what have the scientists figured out in these cases. So let's start our discussion. So this is the case. Let me just quickly show. So these are the two countries here, not to scale. Drawing Norway was a challenge because this part of their border is so interesting. So Norway had 23 deaths. They have given more than 20,000 doses so far, 20,000 doses. And they have usually a routine number of deaths in their nursing homes, elderly homes, are about 400 deaths per week. Norway says that the number of deaths that they are still seeing after the vaccination, or let's say including the side effects of the vaccination, are similar. Germany has seen about 10 deaths, or investigated 10 deaths that occurred within 4 days of the vaccination. Germany has given about 800,000 or more than that doses so far. In Norway, the 23 deaths that have occurred, all are after the vaccination with Pfizer-BioNTech. 13 out of these 23 deaths have been investigated so far. The conclusion is, and let me show you that link here as well. So if you see here, the agency, so their agency is Norwegian Medicines Agency, or NOMA. So according to the agency has investigated 13 of the deaths so far and concluded that common adverse reactions of messenger RNA vaccine, Pfizer BioNTech, such as fever, nausea, and diarrhea, may have contributed to fatal outcomes in some of the frail patients. So then they talk about that in the second paragraph, that when the same adverse reactions occur in fit patients or younger patients, they do not get tipped over to serious illness and death. So it is mostly critically ill or terminally ill who then, when they get the vaccine, they have further aggravation of their underlying disease. Because of this, now they are asking the doctors to assess if a frail patient can receive or should receive the vaccine or not, and they should look at the cost benefit analysis here, that is it okay to leave the patient without vaccine, or should we take the risk of giving them the vaccine? So that is the new thinking they have administered to the healthcare professionals. So back here, this was their conclusion. Their medical director, his name is Steinar Madsen. So if I am pronouncing it correctly, he is the medical director for NOMA. He says they are not alarmed or worried because these are rare occurrences. So again, 23 out of 20,000 administered doses in very frail patients with serious diseases. So they're not seeing this in regular patients or fit patients or younger patients. They are seeing this only in those who are frail and are seriously ill already. Of course, then they're not taking this route to say, you know what, you are seriously ill, so we're going to give you a vaccine anyways, and that might actually tip over the patient. So they're saying in such cases, now we will be more careful to decide if the vaccine can be given or not. So if I continue to see here, here is the message: we are not alarmed or worried about this because these are very rare occurrences and they occurred in very frail patients with very serious diseases. And then Pfizer, what do you think Pfizer's answer would be? Pfizer's answer would be, we are investigating. So here it is. In a statement, Pfizer said, Pfizer and BioNTech are aware of reported deaths following administration of BNT162b2. We are working with NOMA to gather all the relevant information. Another important or relevant thing is the UK. So did UK look at all of these deaths in Norway and then come back and say, you know what, we need to stop this or reduce this or change with another vaccine? So here is UK. Asked if any deaths had occurred in UK patients after vaccination, the UK's Medicine and Healthcare Products Regulatory Agency, MARA, said that the details of all suspected reactions reported in association with the approved COVID-19 vaccine would be published along with its assessment of the data on regular basis in the future. Very similar to our CDC and FDA, that, hey, we are working on it, we'll let you know. Based on the available published reports on the clinical trials, the MHRA said it did not currently anticipate any specific safety concerns. So UK agencies are saying, you know what, no, we are not worried. Norway's agency is saying the same thing as well, that we are not worried because this has not increased any. I think if I read between the lines, and please forgive me to express it this way, if these folks had not received the vaccine, they were already going to die in a few days. And again, not a right way to look at things, because who knows, somebody we think is fit might drop dead, and somebody who we think is frail might live for a longer time. So this is the discussion here for the Norway. Then let's look at the Germany. So Germany has a slightly different stance on this. They have investigated 10 deaths that occurred within the 4 days of the vaccination. So 10 deaths, all of these are in elderly patients, occurred within the four days of vaccination. However, Germany says or the Paul Ehrlich Institute, the one that investigated the deaths, they say that the deaths occurred because of the underlying diseases and not the vaccine. It is just a coincidence that the vaccine was given while a person was reaching their terminal state. In addition to this, what they're saying is that they have seen 0.53 cases per 1,000 doses of adverse reactions, not anaphylactic reactions, not allergic reactions, but adverse reactions, meaning people complaining of the pain in the arm or fever or myalgia or diarrhea or nausea. So they have had 0.53% cases. I should have written here 0.5. No, it's not percent, it is per milli per thousand. So 0.53 per thousand doses. So not a bad number. And severe cases, again, no death here. Severe cases are which we might think about anaphylactoid type reactions, 0.08 severe cases per 1,000 cases. There is one more interesting thing about Germany. They are saying, and so they're also using Pfizer BioNTech. Of course, BioNTech is German based. No contraindication for individuals with allergies except extra observation time. So contrary to UK or US, where we are saying, hey, if you're allergic, please do not take the medicine. Or if you have the reaction to the first dose, then you don't take the second dose. Here they're saying we do not have, in Germany, they're saying no contraindication for individuals with allergies. However, when they are given the dose, we will observe them for a longer period of time. So that is UK's behavior. Germany's approach. I shouldn't call it behavior. And then I have a note over here that, of course, we are aware of the death of a doctor here in Florida as well. After Pfizer BioNTech, his family members say that he was totally healthy and fine, and then he developed the thrombocytopenia, which has occurred in the past with other vaccines. So it's a known problem with the vaccines, although Pfizer has said we have not seen it before and we are investigating and so on. So again, no speculation there because the data is not out there and it is still not connected. Now let's look at it. In Germany, several people die shortly after being vaccinated against the coronavirus. The Paul Ehrlich Institute is now investigating. So here, if you see here, in these cases, seriously ill people died within 4 days of immunization, reported the Federal Institute in Langen, Hesse, responsible for vaccine. But look at this, based on the data that we have, we assume, I do not know why do you assume after the data, but that may be the translation from German to English. We assume that the patient died of their underlying disease in a coincidental manner in relation to the vaccination. So they're saying this is just a coincidence. And look, as the number of people vaccinated will continue to grow, there are people who are dying every day, every hour, every minute. So those coincidents would occur. That is called temporal relationship due to time. So far, more than 800,000 doses are given. Look at this. As of Sunday, the PEI had received 325 suspected cases of adverse reaction, in which there were 913 side effects were reported. So 325 people after getting the dose, vaccine's first dose, reported side effects. And the total number of side effects, for example, I could come in and say I have fever and pain and diarrhea. So these are 3. So there are 903 side effects that are reported, including 51 suspected cases with serious side effects. This corresponds to 0.53 cases per 1,000 vaccine doses or 0.08 suspected cases of serious disease per 1,000. Then this is also interesting. Vaccination opponents should see. So now they are addressing anti-vaxxers to say, hey guys, vaccination opponents should see that they would be protected from serious or even life-threatening course of the infectious disease with a spade. What they're seeing is, and that is what we're seeing with Pfizer and Moderna, that these vaccines are preventing or helping prevent serious cases and deaths due to COVID. I actually think that there is an additional benefit, and that is the prevention of long hauling outcomes that can occur because of the actual disease, where the person can actually come out of the disease but still become a long hauler. So it is actually a good thing to receive the vaccine. So this is the discussion for today. I hope you are all doing well. It is a fast discussion today compared to our daily hour-long discussions. But I thought I had to address this issue first before we could talk about other things. So we'll continue with our open forum tomorrow. So at the end of this, so one more thing, somebody had left a comment yesterday, which was interesting in terms of vaccines. I forgot. If I remembered, I'll talk about it. So DM says lies. This is a genocidal depopulation agenda. I don't know. Do you think that the vaccine is the genocidal depopulation agenda, or is it the COVID itself? So far, with COVID, there have been deaths. With vaccines, there have not been deaths. So I do not know what exactly you are saying. So Arkoman says, here you were yesterday saying this was safe. If this is addressed to me, then yes, I'm still saying this is safe. This is a very rare, if you're talking with me about these deaths, it is important to look at them. And if you see, once again, this is a temporal relationship where it is possible that either the vaccine tipped over someone who was very, very ill and they could not afford to have diarrhea, for example. As soon as they became dehydrated, imagine their heart was already under lots of stress and they just could not sustain increased load in the heart. Or they were really in a debilitated state, and then fever and diarrhea and nausea, they all occur together and they could not sustain it. It happens in our older ages. We all pass away for some reason. So, but the vaccines are safe. So France and Denise agreed. So this is the discussion they are doing here, that it's not necessary to continue to just give the vaccine to all elderly. They are now trying to figure out those elderly that are terminally ill or are in a serious situation already. Don't give them the vaccine to add one more set of side effects that their body cannot handle. One more comment I want to talk about. Somebody, 2-3 times, people have left me a message or a comment that I am somehow just talking about the vaccines nowadays, and I have become a shill once again to vaccine companies now. So it is funny that I am always somebody's shill. Sometimes I'm WHO's shill, or I'm CDC's shill. I'm somebody's shill in somebody's point of view. But here's the deal. Vaccines are happening nowadays. For us to close our eyes from what is going on around us is wrong. So what I'm doing at this time is, just like the beginning of the pandemic, that I worked to inform and explore things together. That is what I'm doing. So we have now looked at how Pfizer vaccine work, and how Moderna works, and how AstraZeneca works, and how the Novavax work. And we'll talk about more for other CanSino and others too. Again, this discussion does not mean I'm pushing you to go get a vaccine. This discussion also does not mean that I am getting some money from someone to say, I'm going to speak on your behalf to say vaccines are great. It is just learning. And that learning, I think, is important. Being informed is better than being misinformed. So this is where we are at. The discussion, the comment yesterday that had come in was, So when I talked about Pfizer, AstraZeneca, yeah. So somebody had left a comment that Dr. What is his name? Campbell. So UK's Campbell is very big proponent of AstraZeneca, and why am I not? So here is the answer, and I think it is clear from the very early days. AstraZeneca's trial data of saying that, hey, in one case we are 62% effective, and oh, sorry, that was 2 full doses, and accidentally somewhere else we gave half and full dose, and now we became 92 or greater than 90% effective. And then let's collect them all together, both of the participants in both the cohorts, and then create an average effectiveness of greater than 70%. I think that is wrong. One set of participants got half dose and full dose, other got full dose and full dose, and the full dose got a lower effectivity percentage. Half dose, full dose got a higher effectivity percentage. They have no idea why half dose, full dose did that. And now they're saying, let's just combine them and call it 70% as well. And then based on that, let's get approvals. That I think is wrong. And I think that is a sleight of hand they are doing. Because of that, I'm not comfortable with AstraZeneca. If they had said, you know what, we are going to discredit the 62%, the 2 full doses trial, we're going to discredit that, we're going to discount that, we're going to remove that. Now we are left with the half dose and full dose, and that gives us about 90%. And maybe we'll continue to expand that trial and prove it. Then that would have been different. So this is why I'm not very hot on AstraZeneca. Cool. So here we are. John Snyder, thank you very much. So let's stop for today. We'll continue with our open forum tomorrow. There is one more news that I wanted to share with you. The ivermectin. So Wayne is talking about that here as well. NIH upgraded recommendation may clear ivermectin's path towards FDA emergency approval. So let's just look at that very quickly as well, because as much as people are excited, I think that NIH is not actually doing the right thing. So let me show you what they are really doing. Here is what they're doing. They're saying, let me share my screen in a second, please. So let me share my screen. This is August 27. Let me bring in January 14. So in August 2014, they had said that they do not like it. They are against it. Now in January, they are saying the COVID-19 treatment guidelines panel has determined that currently there are insufficient data to recommend either for or against the use of ivermectin for the treatment of COVID-19. Results from adequately powered, well-designed, and well-conducted clinical trials are needed to provide more specific evidence-based guidance on the role of ivermectin for the treatment of COVID-19. Now, fine, we can read between the lines here to say they may be open to allow larger scale ivermectin trials, but this statement is not going to get emergency approval because they're saying we have no idea. And if they can ignore all the data today, present, and then classify that as, so look at this, they're saying result from adequately powered. So that means they're saying current data sets are not adequately powered. Well designed, they're saying what is done today is not well designed. And well conducted, so they're saying what has happened today is not well conducted. So I am not a fan of their statement here. Many people became very excited about it, but I actually thought that they, in a very political manner, put a roadblock in front of it while acknowledging that there is some data for this. What is positive in here is that they said there is insufficient data to recommend either for or against. So they are not able to recommend against that either. So that is a good thing. If they can look into their own data set, they would see that the remdesivir does not rise up to the level where they think it is. Even some vaccines do not rise up to the level where they think they should be approved. And these things have actually better data sets and results. So this is just a political statement, in my opinion. I may be wrong. So I did not get very excited with this. To me, this seemed like a sleight of hand. So thank you very much for the time today. Please like, subscribe, and share if you liked my work. There are 2 links in the description. One is to buy me coffees if you would like to buy coffees, or catnips for Luffy, who is already on some catnips right now. And there is another link in the description if you wanted to support my work. So thank you very much, and I would see you tomorrow with the open forum. Have a good day.